Good morning, everyone. Today is September 23rd, and it's almost 9:40 a.m. All commissioners are present other than one, and we would expect him shortly, but we are going to start the meeting. Can I have a motion for the adoption of the agenda?
So moved.
Second.
All in favor?
Aye.
So moved. And item 3 is the adoption of our June 24th, August regular meeting minutes. Can I have a motion to approve? Can I have a motion to approve our August regular meeting minutes?
Move.
Second.
Second.
All in favor?
Aye.
So moved. We're going to move on to our executive director's report, and many of you don't know, but Trent Rohr is not here today. Dan Kaplan is going to be taking his place to help us out. And the good news is that Trent is dropping off his son at college, so it's not an emergency or anything. It was planned. So Dan, I'm going to turn the meeting over to you.
Thank you, Commissioner Khan. So for the executive director's report today, I am going to touch on a few prominent federal issues, some state funding issues that we are dealing with at the current time, and talk a little bit about a local programmatic issue, and then really talk a little bit about how we are moving through what we hope is the tail end of the pandemic period and getting ourselves ready for reopening, both on a physical and on a programmatic level. So to start off with federal issues, the big area that we're focusing on is really federal budget. You know, as you all know, the Biden administration has proposed many packages or many programmatic changes, which are very significant and very progressive, and they are working their way through Congress at this point. I just want to touch on a few of those that are really significant for our program. So the first is the extension of the child tax credit. Child tax credit has been in effect as part of the pandemic response under the American Rescue Plan, and provided for $300 per month per child under the age of 6, and $250 per month per child for children above the age of 6. And in the American Rescue Plan, it was time limited, and the budget proposal seeks to extend that. The proposals also include a universal pre-K program for 3- and 4-year-olds, and new child care benefits for working families, which could save the average family on the order of $13,000 a year, and that, you know, and would provide a benefit that's really accessible to all income levels, but would be most beneficial to lower income working families. The proposals also include higher ed funding that would allow community colleges to be tuition free for 2 years, that increase Pell Grant amounts, make investments in historically Black colleges and universities, as well as others that generally serve students of color. The administration's proposals include federal paid medical leave benefits that give workers up to 12 weeks of guaranteed paid parental and family leave, and improve funding around federal health care support, adding dental and vision and hearing benefits to Medicare, lowering eligibility age, and extending enhanced Affordable Care Act subsidies that have come into play during the pandemic, so that Obamacare enrollees don't pay more than 8.5% of income, and expand, continue to expand benefits so that fewer and fewer Americans are uninsured. Obviously, there's a lot of political maneuvering going on around these packages. We're hearing about this every day, but we are tracking them closely. They will make a huge difference to the populations we serve. One of the aspects of federal programs that have come into play during the pandemic that I think is interesting and we haven't talked about that much is around the federal and local interplay, especially around programs that we don't actually administer directly, but for which our clients have a great interest. And we have a great interest in making sure our clients know about these programs and make use of them. So one example would be the federal tax credit. As I said before, there is a generous benefit, and certainly we want all folks who are eligible to be able to get that benefit. The way the program has been structured on a federal level is that it runs through the IRS system. Benefit distribution is tied to tax filing. But there are significant numbers of people who, because of income, because of their work during the relevant years, haven't filed. And the IRS has set up ways that folks who haven't filed can sign up for the benefits. But we're concerned that many families don't know about the credit or don't know how to file for it. And so on the state level, the Department of Social Services is conducting outreach. It's sending voicemail messages, text messages, email messages to CalFresh and Calworks households about the imminent deadlines for filing a 2020 tax return. And our communications team on a local benefit has developed mailings to let clients know about this benefit, along with other benefits that are funded elsewhere and administered elsewhere, rental assistance programs, eviction prevention, legal assistance, free COVID vaccination clinics, and then one program that we do administer, the Jobs Now program. And so we on the local level have reached out to 1,000 FCS clients, 175,000 ESSS clients, and close to 50,000 IHSS clients and providers. We've done mailings. We're going to be sending texts and emails about these programs. So, the goal here is to assure that the people we serve actually receive the benefits that are designed to help them in this truly difficult time. But we're doing this for programs that by and large, we're not directly administering. A second example of this is around rental assistance programs. So eviction moratoriums have been in place, but they are coming to an end. And landlords will be able to start evicting tenants soon for non-payment of rent. There has been, from the federal government in California, a really large amount of money for helping people who have fallen behind on their rent pay off back rent. In San Francisco, about $115 million has been made available to this. And it's been challenging to get the money out the door. And I think to a large extent, we're wrestling with getting people in to apply for the benefits. But again, we are doing reach out to make sure clients know, so that they will be in a position to make good use of benefits that exist. So when we then kind of turn from the federal level to state level, Trent has mentioned this in the past, but I will sort of re-mention, because it's a big issue in our programs, that this year we have large unanticipated increases in appropriations for a number of programs that are meant to address homelessness in different ways for different subpopulations. And this is funding that's available at the state level and being allocated to counties. In fact, the amounts are so large this year that HSA is beginning to work on a supplemental budget request, which we hope to have out the door over the next month or so, that will address additional money in 6 or maybe 7 programs that we have large unexpected allocations for, or will be receiving them fairly soon. So I'll just mention those because they will have a great deal of significance within HSA's program area. So the first is money through a state program called Project Roomkey. It's money that will be available for funding the shelter-in-place hotel system and the associated wind down of that system. And I know over the course of the pandemic, Trent has spoken a lot about the work we did from the HSA Department Operational Command at setting up the shelter-in-place system and getting it built up to a point where there were 2,600 rooms available for housing people experiencing homelessness during the pandemic. And that program has been largely funded by federal FEMA money. That money hasn't ended yet, although we are anticipating it will end fairly soon. The responsibility for the program management has been shifted to Homelessness and Supportive Housing Department, but HSA is still involved in many of the administrative and financial aspects of the program. And so we have received an allocation of $32 million to fund the tail end of that program and the wind down of that. So that's one very big chunk of money that is new and unexpected and very welcome. The Calworks Housing Support Program, which funds and provides housing for Calworks family by providing housing search, temporary rental subsidies, and case management for folks placed in subsidized housing, is also slated to get a very large increase in funding for this fiscal year and next fiscal year, with the additional money needing to be spent by fiscal year 23-24. We have been receiving close to $7 million a year for that program. We are anticipating this year we will receive closer to $12 million. We haven't received our final allocation yet, so we don't know exactly, but we're assuming it'll be in that ballpark. And that will obviously be a big expansion in the numbers of folks we can serve. There's also been some loosening of the eligibility requirements for that program, so that we are now going to be able to serve people who are at risk of homelessness. In the past, we had to confine our service to people who were in fact homeless already. We are looking at a very big increase in the Bringing Families Home program, which is a program that is designed to help families experiencing homelessness in the child welfare system, with the goal of essentially helping with reunification and making lower use of foster care. This program has received a really massive increase, basically about a 10 times increase for fiscal years 21 and 22 and 22, 23. So we are assuming that in San Francisco, our allocation will go from about 1.3 million a year to about 5 million a year, which will again allow us to serve a substantial additional number of families. We are expecting a very large, well, we know actually in this case that we have a very large increase in our housing disability assistance program allocation. The allocation for that program has been running at about $1 million a year, and our allocation for the current fiscal year has jumped up to $5 million a year. This program, generally known by its acronym of HDAP, is a program that's designed to support folks who are homeless and who are receiving SSI advocacy services with both housing assistance and SSI advocacy, and pays subsidies during the time they're working their way through the SSI application process, which can be anywhere from 6 or 7 months to, in some cases, close to 2 years. So we are working on a proposal for a large increase in dollars and a sort of a new program model for doing that. We are working internally and with partners in homelessness and supportive housing on that concept. And then last of the housing programs, but not least, the Home Safe program, which is a housing program focused on clients of the Adult Protective Services system in DAS, is also going to receive a very large increase. We are anticipating that we'll have about $5 to $9 million that we'll be able to spend between now and fiscal year 24 on supporting folks within the APS system who have housing needs as well. So that'll be a huge area, and we are doing the work, the program development work, and the development of the supplemental budget package on that, and we'll be doing that over the next month or so. There's also additional money associated with the APS program and with the reduction in the age of eligibility for the APS program from 65 to 60 years old. And that will be essentially money for primarily staffing support. It's about $2.5 million a year that we're anticipating. And then the last item I wanted to mention in this list of state-funded programs that will sort of mid-year come into our budget is the one that we are working on. It's probably the most developmental of the various programs that we've got on this list, and it's Universal Guaranteed Income Pilot Program. The state has funded with about $35 million over multiple years pilot projects for guaranteed income programs. And those can be developed on a local level, and we are exploring the development of guaranteed income projects in San Francisco. There are already a few up and running, and so we would be focusing this one, if we move forward on it, on people leaving the foster care system. So again, that's work that we'll be doing over a relatively short period of time, with the goal of getting a new program out the door to be funded by new program dollars. On the local level, Mayor Breed has recently announced increase in the funding and service targets for the Office of Economic and Workforce Development City Build program, which is a program that's designed to get local residents into the construction trades. There should be money to serve 600 local residents over the next 2 years. When we look at who City Build serves in past years, roughly half of the clients who go into the City Build program are HSA clients. So it does become a valuable resource or placement destination for welfare to work clients. Okay, let me shift gears and talk a little bit about readying the agency for return to work. Trent has certainly mentioned in the past that we will be moving into the mode of return to work or return to our buildings. We had originally set a date for return of September 13th, and because of the Delta surge, that was pushed off to November 1st. But we are now working through the process of setting schedules, developing and setting schedules, and workers will be back in the office at a minimum of 40% of the time. For most people, that means 2 days a week. In some program areas, workers will be in more than that. That'll be based on the particular functions that they are carrying out. So we're working through the process now of setting schedules, implementing schedules, and getting ready for that significant change. At this point, we and the city in general are feeling much more comfortable about that because of vaccination, because of declining rates of infection in the community. So let me talk a moment about vaccination updates. As you, I'm sure, know, city employees are mandated to be fully vaccinated by November 1st. There are a number of ways of looking at our numbers, but the way I like to look at it, between those who have reported being fully vaccinated, those being partially vaccinated, and those who have reported being vaccinated but haven't submitted proof, HSA has more than 90% staff vaccinated. We do have a group of about 150 folks at last count who are not vaccinated yet. And our HR department is reaching out and talking with people and acquainting them with information on how to get vaccinated, but also, reviewing with folks requirements for vaccination by November 1st. And we are slowly moving up in our numbers. There is a subset of HSA employees who work in high-risk settings on an intermittent basis, and those employees need to be vaccinated 2 weeks earlier than others. And so that's the group that is getting the initial reach out from our HR teams, but then we're now into working through all folks who are non-vaccinated. So that will certainly be a work in progress, but one we're spending a lot of time and energy on. And obviously we want to come as close as possible to having a fully vaccinated workforce for the benefit of individual employees, for the benefit of their coworkers, for the benefit of their clients, and for the benefit of people in their families, especially children who are not vaccinated and whose exposure we want to limit the risk of as well. So I'd also like to mention at this point that, that we are doing all kinds of vaccination promotion, in a partnership between our our HSA team and DPH. We have been running clinics for vaccination at HSA sites. These are open to staff and to clients. We have vaccinated about 100 people at these clinics so far, and we're going to keep them open for a while longer. And we'll keep pushing in that direction. So the next thing that we are working on as we move into the return to work on-ramp is we are doing a lot of work in our IT systems. We are outfitting workers to be able to work both in the office and from home. That does mean that we are doing a certain amount of additional purchasing and installing of equipment. But at this point, we're really trying to get to a place where most employees can work both from home and from the office. And then we're working on our facilities themselves. We're working on ventilation. We're installing plexiglass in our service lobbies, which we won't have up for all time, but we will have up certainly for this early period of return to work while we still have any significant infection rates in the community. And we're reviewing our cleaning protocols, and we are continuing to have custodial teams do extra cleaning in high touch areas. Interestingly, we are working through all sorts of things in the pandemic that will go on into the future. One of the things I'd like to mention is a sort of a development in our neighborhood. It's not an HSA initiative, it's actually an HSA initiative, but at the City College site that is between our building at 2 Goff and our building at 1650 Mission and our building at 170 Otis, is an old City College site, and that's been used as a safe sleep site during the pandemic. HSH has announced recently that they're going to shift it from being a tent site to being a cabin community for unhoused San Franciscans. And between the late fall and the end of the year, a non-profit provider called Dignity Moves will be replacing the 44 sleeping platforms at the site now with 70 quick build cabins, which are meant to be sturdier and meant to provide a greater degree of privacy for folks. So we'll have that in the area, and that will continue at least for a while into the future. Okay, let me shift to what's been going on in some of our benefit programs, again, relating to the pandemic and then the period of coming out of the pandemic. So as I know Trent has mentioned in past meetings, last fiscal year, our Jobs Now program slowed significantly. In many of our benefit programs, work requirements were relaxed, jobs in the community were less available, and clients, especially those with children, had more need to stay home during the pandemic. As a result, the Jobs Now program, which is really built around a lot of subsidized employment, was underspending pretty significantly. We proposed, the mayor supported, a significant shift of dollars from that program to pandemic-focused programs that were operated over the last part of last fiscal year and through this fiscal year. And these included things like a digital divide initiative, where we provided laptops and tablets to about 1,000 clients, and also paired that with digital literacy training and technical support, simply because digital literacy and connectedness became much more important during the pandemic for both economic and other reasons. We recast the Working Families Credit Program. In total, there were 3,900 households who applied, and 3,300 had been approved for payment so far. And we, in essence, doubled the payment cycle on the Working Families Credit. We also put in place a couple of cash payment programs for families who, primarily because of immigration status, wouldn't have received federal stimulus funds. So we established a $3 million gift card program that is aimed at Healthy San Francisco participants, and it's being administered in partnership with the San Francisco Health Plan. So in this program, we've sent $550 Visa gift cards to about 5,500 undocumented low-income families. And that has just happened over the last several weeks. We've also, on a more client-by-client basis, been providing benefits of up to $2,500 one time for families on Calworks who didn't receive a federal COVID-19 stimulus fund, and that's gone to about 430 families. So just to circle back on jobs now, as the economy has begun to improve, and as vaccine rates have gone up, and as businesses have reopened, we are once again able to place people in subsidized employment through Jobs Now. So far this fiscal year, we've made 340 unsubsidized and subsidized job placements. And so that program is beginning to take off again. And obviously that's a crucial program for us in terms of getting people into the workforce. So we're glad to see that it is lifting off again. Another thing that we've been working on, and it's not necessarily a pandemic program, but it's a program or an effort designed to do a better job at reaching people potentially eligible for Calworks or Calworks benefits, is we've been exploring the use of what in the Calworks program is called the Diversion Benefit. And the name is not a great one for what we're interested in, but it is a program within Calworks that allows us to provide short-term, one-time benefits to folks who would qualify for Calworks, but who might not, for any set of reasons, want to be on the Calworks program. Certainly over the last year and in the Trump administration, there's been a lot of talk about public charge and public charge anxieties among communities, of immigrant communities. And one of the good things about the diversion program is it allows people to receive a benefit that is not necessarily one that will put them at any real risk of public charge designation, which of course would make it harder for them to get green cards and citizenship down the line. We are coming out of some of the policies that have been associated with the pandemic. So in our CAP program, we suspended or relaxed requirements relating to work and or SSI and counseling requirements. We are resuscitating those, and they will start going back into effect on October 1st. At the same time, we're going to be making several changes in the CAP program to simplify application and to improve client service. In the past, we have required a triage or employability assessment appointment before approving eligibility. Now we're going to still require that the appointment occur, but not before eligibility is established. This will have to be done after eligibility, and that smooths the process for clients. In addition, we're moving towards what we call a generic model for serving ongoing or carrying clients, which should allow us to improve service to those clients and spread workload more evenly through our CAP workforce. In our SFBN area, which handles CalFresh and Medi-Cal eligibility, SFBN is now cross-training staff in CalFresh and Medi-Cal, so that the carrying staff or the staff that worked with ongoing cases will be able to work across both programs more broadly. This helps us with the distribution of workload. It allows for greater flexibility in staff assignments, and ultimately it allows us to provide better customer service because we can allow workers to really work in the areas where the workload is at any given moment. The training on the cross-training for carrying staff will occur in groups of 40 between now and March 22. Also in SFBN, during the pandemic, both the Medi-Cal and the CalFresh programs have been working under waivers that have collectively made it much easier for clients to receive and continue benefits. And in the case of CalFresh, have made the benefits a bit more generous and extended them to additional populations like students. At the present time, it looks like most of these waivers will remain in force through the end of this calendar year. And some, like the implementation of the ABOD or able-bodied adults without dependents work requirements are expected to remain in force at least till June. So at this point in the SFBN program, one of the big activities is really planning how we will handle the end of waivers, how we will start doing redetermination work. And at this point, we don't have full information on what that's going to look like from the state and the federal government, but we're learning more all the time and beginning to plan out how we will deal with this changing workload once it's in front of us. In FCS, I am not going to report anything in this report. Liz Crudo and Joan Miller are going to talk about FFPSA or Families First Prevention Services Act, which is a very significant change in funding around child welfare programs and especially preventive services programs within child welfare. So I will let them do that presentation. This is a major effort that the state has been working on for a couple of years now, and we have been slowly developing the program background on, and will be rolling out in the near future. And then last, I would just like to mention the work of our Office of Diversity, Equity, Inclusion, and Belonging. Again, a group that Trent has mentioned on a regular basis. This is a major area for us that we've been focusing on over the past couple of years, and certainly will be focusing on in an ongoing way. In September, the DEIB office issued its second quarterly racial equity newsletter that focused on the implementation of our racial equity plan and many of the the particular elements of it. We have begun work or gotten out the door an agency-wide racial equity survey. That's a partnership between our DIB unit and our planning unit. And the purpose of this is to better understand staff experiences in the workplace and get feedback and opinions to guide racial equity activities and priorities. So we'll have information from that in a month or two. We are working with our hiring team within HR and with hiring managers to put in place best practices for selecting diverse, inclusive interview panels and adopting strategies for mitigating bias in the interview process. We are beginning work on a pilot program on peer mediation. This runs through citywide DHR, but the goal is to have workers who are trained up to provide mediation services to help resolve workplace conflicts. And finally, Trent and his counterpart, Kelly Dearman and Das, have participated in a listening session with the racial equity work group members, where they were able to share their vision for racial equity at HSA and hear about the concerns and experiences of the members of the racial equity work group. So I am going to stop there and attempt to address questions if there are any, or if not, to move forward on our agenda.
Thank you very much, Dan. Are there any questions from members of the commission? Are there any comments or questions from members of the commission? Rita?
I forget whether I've asked this before, and if I have, I apologize. But is there any implicit bias training going on?
I'm saying, implicit bias training.
Yes.
So, so there is implicit bias training that is citywide training that is available and required for HSA employees. When people serve on hiring panels, they are required to do implicit bias training. And in fact, they're required to do it each year. I have done it twice myself at this point. So that's in place. There's a larger series of DIB training that we are working on, and I think the first round of it is set to focus on upper level management and commissioners, and so you will be hearing a request for approval today for a training contract. Asa King, our DIB manager, will be bringing that to you. So the answer to your question is yes. It has been rolling out slowly, but it is rolled out in a number of places. And it's been, it's been, I would say, Commissioner Semmel, about 5 years that this rollout process has been going on. So it's been gathering steam.
Thank you very much.
Are there any other questions from members of the commission? Okay, then we're going to move on to the presentation of our September 2021 Employee of the Month, who is Shou Hong Ling. And I'm going to read what was written up here about his work. The commission is pleased to announce that Shou Hong Ling, an information technology desktop administrator is the September 2021 Employee of the Month. Show has been with the Human Service Agency as an information technology desktop administrator since 2014, providing technical assistance to over 2,400 staff. He has been in the office almost every day since the pandemic began, helping staff to navigate their technical issues in delivering new equipment. Show and the desktop team support not only our agency employees, but also the COVID Command Center and the Department of Operations Center. Show is passionate about his job and cares deeply about helping others. Has excellent customer service skills, both in person and over the phone. Always striving for first call resolution. It is not unusual to see Show spend extra time with staff going the extra mile to teach them new tips and tricks. In the last 9 months, Show has personally handled 730 incidents and tasks. Show is currently leading the efforts for the Return to Work Monitor Installation Project, backfilling over 400 monitors throughout our buildings. In addition to project, Show is also always willing to lend a hand to his coworkers and share his knowledge. We would like to congratulate Show and for all of his accomplishments and thank him. So Show, thank you very much. Do you have, well, let's start with Dan. Dan, do you have any comments?
Sure. I want to congratulate Joe. I want to also just make the point that, you know, in most of our reports, we tend to focus primarily on the programmatic side of the work we do. It's reasonable, but there is a significant team of folks who support the operations of HSA, and Show is of course a great example of someone who does a great job at this and goes beyond. And you know, since we live in a world of computer technology, and that's become even more the case during the pandemic, our ability to have well-functioning data systems and well-functioning connections is absolutely crucial to the way we've been able to carry on during the pandemic. And Joe is an example of someone who really makes that work. So, you know, I think we all have to say to Joe and to his coworkers that you know, this is crucial and recognized, and we are very aware that this agency runs on a lot of pieces of its infrastructure, but certainly its computer systems are very important. So congratulations, Joe, and congratulations to your coworkers as well.
Thank you.
Show, do you have anything you'd like to share?
Good morning, everyone. Thank you to the commissioner for presenting me with the honor of the Employee of the Month award. I'd like to thank my family and my work family, which are my teammates, for always helping me and supporting me. I'd like to thank my supervisor, Judy, for her continuous guidance. Next, I would like to thank all of our IT teams and management for supporting me and providing me with tools to allow me to complete my tasks. Lastly, I would like to thank all of our Human Service Agency staff that I work with every day for their amazing patience and cooperation. I will continue to work hard and live up to this award. Thank you again.
Thank you, Shao.
Congratulations, Show. And thank you for
Thank
all
you.
your help.
Okay, now moving on to item 6, the consent calendar. Do any of my fellow commissioners want to move an item for individual discussion? If not, can I have a motion to approve?
So
So
moved.
moved.
Second? All in favor?
Aye.
So moved. Item 7, Family First Prevention Service Act. Calling on Liz Kudo and Joan Miller.
Hi, good morning, Commissioners. President Khan, thanks for having us here today. Dan mentioned it very briefly in his opening remarks that it is a large initiative that is actually to be implemented October 1st, which is right around the corner, I think next Friday. So we wanted to bring this to you and just sort of give you a very high level overview of what it means. In a nutshell, it not only changes how we claim to child welfare Title IV funding, that's the, the budget fiscal end of it, but in a programmatic standpoint, it is a very huge shift to a prevention, having child welfare be a prevention-based program rather than sort of a reactive-based program. There's going to be a large component where we're going to be able to hopefully implement more prevention services and keep children out of the child welfare system and served in their community. And the second piece, it has to do with how children are placed in higher level of care. There's now going to be a court oversight component that was not there before. But Liz has a great presentation for you. And without further ado, I will turn it over to Liz. Liz, you're on mute.
Sorry about that. Can everybody see my screen with the PowerPoint that's showing? I will dive in. Thank you, Joan. So Family First Prevention Services Act, federal legislation that was signed into law a couple of years ago. This is really changing the landscape of child welfare. Probably the most significant thing that's happened in decades in the field. And it expands federal resources to drive the outcomes that we want to see for families. So we want to see families stay together. We want to prevent child maltreatment. We want to ensure that children who are in foster care live with families and improve access to quality residential treatment. The funding really pushes towards all those things. So basically the feds are putting the money where their mouth is, and there are related practice changes that the state is implementing that will push that as well. So the Family First framework has 3 fundamental principles: helping children who are at risk of removal stay with their families, and that can include children who are not have not yet hit our system. Ensuring that children in foster care can live with a family, and then improving access to high quality congregate care. So there are actually 8 parts to FFPSA. The part 1 and part 4 are the ones that impact child welfare. Part 1 focuses on prevention, and part 4 focuses on congregate care and related new limitations on that and requirements. California passed AB 153 in July to achieve full compliance with the federal law. And the federal law kicks in next Friday, October 1st. And we are still, I'll just say, we are still awaiting a lot of specifics from CDSS for implementation. But in the meantime, we are forging ahead with the information we have. So I want to talk a little bit about part 1, about prevention. And the federal funds, Title IV funds for that are going to provide increased support for evidence-based intervention. That will allow for service delivery that can help mitigate issues of disparity and disproportionality and maltreatment and trauma, including trauma imposed by the very fact of being removed from your family and placed in foster care. So service delivery is going to have to meet certain specifications that qualify them as evidence-based practices. And there's a federal clearinghouse that identifies eligible services and programs. But basically, they're focused on mental health services, substance abuse prevention and treatment services, and parent skill-based programs, which can include parent education, individual and family counseling, and other in-home or out-of-home skill-based training for parents. So it's not only geared towards children specifically, but really is also including the caregivers and parents to receive these treatments and services that can make a difference for families. And we know they can make a difference because they are evidence-based, and that's what the outcomes shows. There's kind of 3 levels with the services: promising, supported, and well-supported. California, as we enter into the initial planning period, is designating the utilization of the well-supported practices on the federal clearinghouse. There's not a lot of them, but obviously they're well-supported, so we know that they can make a difference for families. And for the candidacy, the people that are going to have access to this prevention arm are children at imminent risk of foster care and their parents and caregivers. So again, making sure to include the family system, not just focus on the child, and then pregnant and parent in foster youth. And there will be an assessment and prevention plan requirements with this. So again, I mentioned that families do not have to have open cases to receive these interventions, but they do have to go through an assessment process where we will determine that they are at imminent risk of foster care. And then we'll have to develop, in collaboration with our partners, a prevention plan for that particular family and what we want to achieve with the services. So the target population, imminent risk of foster care, this is how the state is identifying that population. And it includes both families that have touched our system and who are in voluntary cases with us, who are non-court family maintenance or may have gone through our system and achieved guardianship and adoption, or perhaps are getting differential response services. They've had substantiated or inconclusive referrals, and we've connected them with our differential response partners to provide services. But they're also expanding it to these additional, I won't read this off to you, but these additional families with these particular risk factors, so that, again, a referral doesn't necessarily have to come to our hotline. Our providers may be able to identify families at risk and work with us to go through that assessment process and prevention plan process. So it's really pushing us to a more true prevention continuum of care. We have a lot of foundation in the county in our prevention efforts, and that includes these different efforts here. We have an interagency prevention task force. The Controller's Office did a prevention services mapping a couple years ago that helped inform that development of that workforce. We have our Family Resource Center initiative that includes our differential response.
Hello,
and we do have evidence-based practices.
Yes.
How are you?
I'm in the
already-
meeting. What's doing?
Oh, sorry. I was wondering if I could drop off 8 letters for you to write by October 16th to Virginia voters.
Commissioner Semmel, do you think you could put your screen on mute?
I'm sorry?
Yes,
Thank
you
you,
can.
Susie. Commissioner
Okay.
Semmel, mute yourself.
Okay, I'll stop by briefly around 1 o'clock.
Okay.
Okay. So again, we have a number of things here that we can build off of for expanding this prevention work. And we do have evidence-based practices in the county, some of which are the same as on that federal clearinghouse. That would include things like the nurse family partnership, parent-child interaction therapy, and parents as teachers, which I know our Calworks program is very involved with that. We have strong interagency partnerships with our providers, as well as our county partners like First 5, DPH, and DCYF. This picture here is actually the Waller Street location for Safe and Sound. That's our Child Abuse Prevention Center. Very strong partnership with them, and they will be right at the table with us as we develop this work. We issued an RFP about a couple months ago for a consultant to help us go through the planning process that is going to be necessary in the county to identify which services we will use for FFPSA, including ones that we currently are offering, and any that we might want to expand to, which agencies we're going to work with to provide those, and a number of different things that we will be required to do. There's a lot of implications for the support that we are going to have to offer to meet all the requirements that the feds and state are mandating for us as we move forward towards implementation. And that includes implications for funding, training, extensive evaluation, contracts, claiming. So we're waiting for a lot of direction in those areas from CDSS about the requirements. But we have, again, a very strong foundation in our county. And over the next year, we'll be engaging in a planning process so we can really identify what things will look like here. So I want to move to part 4. And this focuses on improving access to high quality residential treatment. So again, we have the prevention arm, and then really expanding out on the other side of the continuum for kids in congregate care and how we can improve that so that congregate care is really focused, a short-term focused program, treatment intervention, that we can mitigate issues, behavioral issues for children, and get them to family settings as soon as possible and help them stay there. There are federal exceptions around requirements for STRTP, but for the most part, most of our congregate care programs are going to have to meet certain expectations from the feds. And California has gotten ahead of that, fortunately, through the continuum of care reform efforts, which transforms group home and congregate care settings to expanded programs that are called short-term residential treatment programs. So really trying to move again towards short-term, robust treatment facilities that can help children step down to family homes. So the STRTPs, we're going to continue that language in California. The feds use QTRPs, Quality Treatment Residential Programs, but in California, we're calling those STRTPs. There are some additional requirements that the feds have that the state will have to require STRTPs to do. And in order for us to draw down 40 placement dollars for placements, we have to place in facilities that have those additional federal requirements. If they don't meet those additional federal requirements, we can only draw down federal dollars for 2 weeks that the child is there. And then after that, it's kind of on the county to pay the cost. And that's quite expensive. It's $13,000 a month. So fortunately, because California has had CCR, most of the facilities are going to meet those federal requirements. But there are a couple things that are falling into place. Agencies have to be accredited. And again, with CCR, most of the STRTPs are. They're also going to have to provide access to 24/7 nursing service. So CDSS has an RFP out that was issued in July for 24/7 nursing service that will be able to be accessed virtually. And so the STRTPs will be able to access that service and meet that federal mandate about providing 24/7 nursing availability for children who need it. They also will be required to have trauma-informed treatment models. CDSS is looking at the licensing regulations to make changes as needed. Part of that will include more robust engagement with families and bringing them into the treatment planning process, and utilization of the child and family team structure to do that. And then finally, STRTPs are going to be required to assist with the provision of aftercare as children step down to family settings. And in California, that is looking like it's going to be wraparound. So as children step down into family settings, we will be required to offer 6 months of wraparound services to them to help that be a successful transition to a family home. So that's what the STRTPs are required to do. And then for the county, there are things that we are also going to be required to do starting next Friday as we place children in STRTP settings. And those fall into a qualified individual assessment process. There are additional case plan oversight and requirements, and then additional court oversight. That kind of changes some of the purview of child welfare. So I want to talk briefly about those so you can get a sense of the direction that child welfare is moving in, because it really does change the landscape for us in terms of our purview. So this QI assessment, qualified individual, that is an additional layer of assessment to determine if an STRTP placement is appropriate for a child. And really, it needs to justify why a child's needs cannot be met in a family setting. So that qualified individual is someone supposed to be a neutral person, an objective assessment process conducted by someone who is not an employee of the Title IV agency. So it cannot be our employee or a juvenile probation employee. And it also cannot be affiliated with placement provider. So it can't be somebody who works for the STRTP or any other kind of placement. And that kind of does have some impact on our county, because mental health partners at DPH have contracts with a number of mental health clinicians who work for agencies that also are FFA, foster family agencies. So like AFS, Alternative Family Services, and A Better Way, they provide a lot of clinical services for our county, but because they also do foster care placements, they are not going to be able at this point to participate in the QI assessment process, which creates some capacity issues on the mental health side. So we are working with mental health to identify who within their system can provide this qualified individual assessment. And they've got some staff who will be helping with that. And the work of the QI assessment is to really engage and partner with the members of the child and family team and conduct a child and adolescent strengths and needs assessment that can identify short and long-term behavioral and mental health goals and treatment needs for the child. If it's a Native American child, they also need to consult with the child's tribe in this process. So really looking at that family engagement, trying to do an objective assessment and identify why the child can't be in a family setting and what behavioral interventions are needed to help the child get back to a family setting. And on the parallel side for child welfare, there are changes in the case plan requirements that we will have to do. And similarly, that includes our engagement of the child and family team meeting. We're going to have to include in this our reasonable efforts to identify and include those members in our planning processes. We're going to have to provide evidence that our child and family team meetings were held at a time that was convenient for the family. And that's all our child and family team meetings, not just the ones focused on this QI assessment process to gather feedback for the family. We're going to have to include information about our placement preferences and if they differ from the QI assessment, why that is. And then other information about aftercare supports, what's planned for the child when they are finished with the treatment at the STRTP that can help them step down and be successful in a family setting. You kind of see these themes over and over again about engagement, short-term treatment, including the child and family team meeting, and really looking at the support, specific things that are needed for children to be with a family. The court hearing process, this will be an additional court hearing that will have to happen within 60 days of placement. That QI assessment, the QI provider, ideally we're going to be doing that before the child gets to placement, but we have within 30 days of an emergency placement to get that QI assessment done. So that QI assessment has to be done within 30 days. That's really tight. That's a very tight time frame to get that done and in time for this hearing. So we'll have to provide the QI assessment and our new court report and case plan process to the court. The 60-day hearing cannot be pushed out. We are mandated to have it within 60 days. There's no continuing it. So things have to happen pretty quickly to get the information we need for court. And the court now will be taking all that information, that QI assessment, the information from our staff, and making a judgment about the appropriate level of care that the child needs. And then the court is approving or disapproving the specific placement, not the level of care, which they have done, but taking that specific placement decision out of the purview of child welfare, which it has traditionally been in our purview, and the court itself will be approving that particular placement. And then there's a continued oversight process if the child does go to that placement, where we will have to continue to come back to court and share information on progress and plans for step down. If the court doesn't approve the placement, we have 30 days to move the child to a different level of care that the court approves. So I showed you those last couple slides really just to emphasize the change in practice and the changes in the Child Welfare Authority and purview that this process is driving. And there's a lot of detail, not just with the big picture, but in forms and directives from CDSS that will be coming down that will support that. There's also a placement preservation strategy process that the state is implementing on more formally. This happens to some degree now, but there will be meetings that the county and the STRTP will be required to participate in with the state, so that we can look at how to address any issues that are coming up that put a child at risk for placement disruption and move to more planned discharges. And similarly, we will continue to work with providers and caregivers in that regard. I mentioned there's a lot of pending ACLs coming down from the state, and you can see here, this is a list of those. There's been one ACIN that was issued a couple weeks ago, but we're waiting for a lot more information in a number of these different required areas that are taking effect next Friday. So we have a lot of work to do with our policy. We've got a great group of staff putting policy together and starting to get the word out to staff as these changes hit the ground. So we're moving very quickly to get it all in place while we're still awaiting direction. So that is the information we have to share, and Joan and I would be happy to address any questions. I know that was a lot of information.
Thank you both very much. Are there any questions from members of the commission or comments? Hearing none, we're going to move on to.
Thank you, commissioners.
Thank you. We're going to move on to item 8, which is commission business action items. Item A is requesting authorization to renew the grant agreement with Arriba Juntos for the provision of virtual tax preparation services from October 1st, 2021 through June 30th, 2024, and the amount of $289,752 with a contingency, 10% contingency, $318,727. Calling on Andy Beatley-Hagler.
Yes, good morning, President Khan and commissioners. My name is Andy Beatley-Hagler, and I'm the program monitor for the Technology Supported Tax Preparation Assistance Services contract. And so I'll be covering both items A for Arriba Juntos and B for Meta in my presentation. The Department of Benefits and Family Support requests authorization to renew the grants with Arriba Juntos and Mission Economic Development Agency, Meta, for the period of September 1st, 2021 through June 30th, 2024, in the total amount not to exceed $637,454. The purpose of these grants is to provide virtual tax preparation assistance to low-income San Francisco residents. HSA clients already have access to a robust, free, in-person tax preparation assistance network through a partnership between the IRS Volunteer Income Tax Assistance Program and the United Way Bay Area-led coalition of agencies who offer at least 25 free tax prep sites and access points throughout the city. Through this program, HSA seeks to complement these existing services by providing virtual tax preparation assistance services to clients who may find this alternative model to be more convenient. The program has 5 goals. 1, help clients file their taxes free of charge. 2, help individuals and families receive federal, state, and local tax credits and tax refunds. 3, utilize technology to minimize the amount of time clients are required to be present for tax preparation services. 4, link free tax prep clients to other financial services such as free banking and financial counseling. And 5, deliver these services in HSA offices during business hours, allowing clients to utilize multiple services during the same visit. Grantees will assist at least 550 low-income San Franciscans with their tax preparation and file a minimum of 450 tax returns. I'm available to answer questions regarding the services, and we've got a lot of folks here at the meeting representing for their agencies. From Meta, we have Jackie Marcelos, Financial Assets Program Manager, and Claudia Soto, Financial Capability Coach. And from Arriba Juntos, we have Andy Yee, Programs Assistant Programs Coordinator, Veronica Ching, Advanced Tax Preparer, and Gladys Garcia, Director of Programs. Thank you.
Thank you, Andy. Can I have a motion to approve item A?
So move.
Is there a second? Second, anyone?
Second.
All in favor?
Aye.
So moved.
I'd like help with my own tax returns.
Item B, requesting authorization to renew the grant agreement with Mission Economic Development Agency for a provision of virtual tax preparation services for a period of October 1st, 2021 through June 30th, 2024. In the amount of $289,752 with a 10% contingency. So we're voting on $318,727. And we're calling on, so he presented that, so we're just voting on it. So can I have a motion for approval?
So move.
Second.
All in favor?
Aye. Aye.
So moved. Thank you. He already did that.
Are we still doing C?
Are you-
Presenting C?
You're presenting C
Yes.
also?
Mhm.
Okay, go right ahead.
Sure. All right. Well, so yes, good morning again. I'm Andy Lee Hegler. I'm the program monitor also for the Refugee Benefits Linkages contract. The Department of Benefits and Family Support requests authorization to modify the existing grant with Arriba Juntos for an additional period of October 1st, 2021 to September 30th, 2023 for an additional amount of $180,940 plus a 10% contingency for a total amount not to exceed $388,682. The purpose of the grant is to link refugees, asylees, and trafficking victims resettled in San Francisco and its surrounding counties with local services and benefits that can improve their self-sufficiency. Recent data from the U.S. Citizenship and Immigration Services indicates that there are about 200,000 asylum applications currently pending in California. Over the previous 2 federal fiscal years, 1,038 asylum cases were approved in San Francisco County. The Human Services Agency seeks to link these individuals to available refugee and self-sufficiency resources and services available throughout San Francisco County. The COVID-19 pandemic exposed a digital divide in San Francisco as well as nationwide, and HSA aims to support the refugee community to provide assistance with digital services as well. The grantee will identify eligible clients and make service and benefits referrals tailored to the client's needs. These services will include, but are not limited to, language, education, and vocational training programs offered by various agencies in the Bay Area. Clients will also be referred to HSA intake for screening and possible enrollment in Refugee Cash Assistance, which is RCA, Calworks, CalFresh, and Medi-Cal. The grantee will connect this program's clients with workshops on social adjustment, cultural orientation, citizenship activities, and personal finance, among other services in the community. The grantee will perform a minimum of 20 benefits linkage events to connect with refugees, asylees, trafficking victims, and individuals on special immigrant visas every month. Over an annual period, 45 individuals referred through benefits linkages will enroll into HSA services. I'm available to answer questions regarding the services, and representing from Arriba Juntos for this program are Patricia Melgar, Arriba Juntos' training coordinator, and Karina Torres, case manager and employment specialist. Thank you.
Thank you very much. Are there any questions or comments? If not, then I'd ask for a motion to approve.
Move.
Second.
All in favor? Aye.
Aye.
So moved.
Thanks, commissioners.
Thank you, Amy. Item D, calling on Kathy Huang. And item D is requesting authorization to modify the existing grant agreement with the San Francisco Marin Food Bank for provision of COVID-19 food assistance program for the period October 16th, 21 through June 30th, 2022 for an additional amount of $6,750,000 plus a 10% contingency for a revised total not to exceed $24,504,508. Kathy?
All right, hello commissioners. My name is Kathy Long. I'm the nutritionist of the Food Coordination Group. Today I'm requesting authorization to modify our contract with the San Francisco Marin Food Bank in order to sustain our COVID-19 food assistance programs. The COVID-19 pandemic has left many San Franciscans struggling to make ends meet. Projections from Feeding America indicate that food insecurity in San Francisco has increased by 22% among the general population and 44% among children between 2019 and 2021. Due to the high cost of living in San Francisco, federal formulas applied to Calfresh and other food benefit programs leave many San Franciscans without much needed food support. In response to the increased need for food support in San Francisco, we have a sole source contract with the San Francisco Marin Food Bank to provide 2 supplementary grocery programs. The 2 programs are the Pop-Up Pantry program and the Pantry at Home program. Pop-up pantries are outdoor grocery distribution sites that provide supplemental groceries directly to San Franciscans in need of food assistance. We currently have 21 pop-up pantries located in various neighborhoods all over San Francisco. The other program, Pantry at Home, is a grocery delivery service that provides supplemental grocery items to those who may be unable to visit a pop-up pantry, including COVID vulnerable populations. In July and August of this fiscal year alone, over 117,000 bags of groceries have been handed out at the pop-up pantries, and over 38,000 bags of groceries have been delivered through the Pantry at Home program. In the most recent survey of program participants, 98% of Pantry at Home participants responded that they were able to shelter in place more easily due to this program. 71% of pop-up pantry participants responded that someone in their household lost their job or earned less income due to the pandemic, and 81% said that they have not recovered from this financial loss. Today's contract modification would continue these vital food support programs through the end of this fiscal year. Also, as a part of this modification, the food bank will continue its drive-through pantries to provide food boxes to those unable to or uncomfortable going to walk-up pantries. They will pilot culturally responsive food items at select pop-up pantries, and they will expand their Pantry at Home service to include families with children under 2. Funding for this grant is provided through the County General Fund and federal funds. With me today is Sean Brooks, Chief Program Officer of the San Francisco Marin Food Bank, who would like to add a few words if you don't mind. Thank you for your time.
Go right.
Thank you, Kathy.
I just have, Mr. President,
Yes.
I just have a nitpicking request of Ms. Wong, and that is to refrain from using the word contract when we have a grant. We've been through this many times, and I think we need to be vigilant in being consistent with the standards that are in place. So,
Yeah, no, definitely. Thank you. This is my first commission presentation, so I do thank you for that.
yeah, well, the memorandum is fine, but orally, and certainly in the English language, it's permissible to use agreement and contract and things like that fairly interchangeably, but they have special meaning apparently, which is significant. And so with that, I will be very pleased to move approval.
Commissioner Yamasaki, we have not finished the presentation. Mr. Brooks was going to add a few details.
Maybe you missed that. Yeah, so calling on Mr. Brooks.
Good morning. Can you hear me?
Yes.
Okay, great. I would like to extend the appreciation of the food bank community to the leadership and staff of the Human Services Agency in the county for all the support you provided to critical food assistance programs during this tragic pandemic. And thank you, commissioners, for your consideration again today. Your support, together with the help of about 750 volunteers a week, allows us to provide about 25 pounds of fresh seasonal produce and protein and grains to an additional 23,000 San Francisco neighbors every week, including 16,000 through our 21 weekly pop-up pantries and another 7,000 COVID vulnerable residents who are primarily older adults through our weekly pantry at home delivery program. Though infection rates have started to drop again, fortunately, demand for these food assistance programs continues to grow. 4 of our 21 pop-up pantries are basically at capacity, and another 4 are facing kind of capacity constraints over the next few months as enrollment rates of about 150 new participants every week are coming to our pop-up pantries. At the same time, we're also currently enrolling about 250 newly eligible families with infants or children with disabilities every week for our pantry at home deliveries, and anticipate maxing out our current delivery capacity before the end of this calendar year. We are bracing for the likelihood that demand will continue to be strong for several years after this pandemic, similar to what happened after the Great Recession. The rate of increase in demand of the food bank's pantry network peaked after the Great Recession in 2010. So it had grown another 22% the year after the recession. And then it slowed down to 16% growth the second year after the recession, before really narrowing to kind of minimal growth 3 years after the recession, before beginning to rise again. And overall participation never came back down. If you wouldn't mind, I'd like to close my remarks by sharing 2 notes we received from appreciative participants. One was from Christina, a single mom with a teenage son and a daughter living in El Salvador, who said, "Most of my money goes to bills. If these programs didn't exist, I wouldn't feel like I would be able to properly feed my son." And another one was from one of our pantry at home delivery participants, who recently shared, "I thought, what am I going to do? Where am I going to get my food? My immune system is compromised and I can't go out. These home delivered groceries are a lifeline. And then I receive these groceries. I've never been able to eat like this in my life. I got chicken and mayonnaise with olive oil. I received the largest cabbage, and I love cabbage." So thank you again for your crucial support, and I would be happy to take any questions or feedback you might have.
Well, thank you, Sean. Commissioner Semmel's got her hand up, I see. She has a question.
I know about the work of the food bank for many, many years. It's incredible. And without it, families would be in dire straits. So I would like very much to make a motion to approve this grant.
I appreciate that, Rita. Okay, we're going to move forward on a.
My motion is pending if it
Okay,
requires a
is there,
second.
is there a second to Commissioner Semmel's motion? Is there a second?
Mr. Chair, I think that Commissioner Yamasaki had a motion on the floor earlier, and
Just requires a second.
yeah, and so I will second whichever one you want to take.
Thank you.
Yeah.
Okay, can I have a motion to approve then?
Second. Oh.
All in favor?
Aye.
Thank you very much.
Aye. Thank you. Thank you.
Thank you all.
Item E, calling on Karina Zhang. Item E is requesting authorization to modify the existing grant agreement with San Francisco Community College District for Title 4E training services for additional period of October 1st, 2021 to September 30th, 2022 for an additional amount of $863,527 with a 10% contingency not to exceed $1,899,759. Karina?
Hi, good morning, commissioners. Good morning, everyone. My name is Karina Zhang, and I'm a program support analyst with the Family and Children's Services. I'm here today to request your authorization to modify the existing grant with San Francisco Community College District for an additional period of October 1st, 2021 to September 30th, 2022 for an additional amount of $863,527 plus a 10% contingency for a new grant amount not to exceed $1,899,759. And this modification extends the grant term for 1 additional year. The purpose of this grant is to make available a training curriculum that fulfills the requirements of the federal Title 4E training program to build and strengthen agency and care provider capacity to improve outcomes for children, youth, and families in San Francisco. This training curriculum is offered to RFA foster parents and relatives, caregivers, group homes, foster family agencies, as well as our Family and Children's Services staff and other Title 4 eligible service providers. Together with their subcontracted agencies, City College will provide 2,856 hours of classroom and field training to serve 1,388 unduplicated partner agency staff, parents, and FCS workers in fiscal year 21 to 22. And lastly, the funding for this grant is 100% federal Title 4E funds. And I am here. With me today is Stephanie Chenard, the Director of Contract Education and Extension Programs from City College. And we'll be happy to answer any questions you have about this grant.
Thank you very much. Stephanie, do you have anything that you'd like to add? Is she online with us?
My apologies, I can't see everybody on the screen.
Well, I don't see her here.
Yeah, I don't see her name, but there are a couple of phone numbers. My apologies.
It's okay.
Yeah, we did communicate, and I'm sorry, she may
No,
not.
No
Yeah.
worries, no worries at all. Okay, can I have is there any public comment? Oh, I'm sorry, Rita, I didn't see your hand up. Go ahead.
I move approval.
Second,
Okay, all in favor?
aye.
So
Thank
moved.
you. Thank you so much.
Item F, requesting authorization to enter into a new contract agreement with Accenture LLP for the provision of racial equity training and for HSA executive leadership for a period January 1st, 2022 through March 31st for a total contract and the amount of $129,000. Asa King, I'm sorry. I turned the page too quick. Hi, Asa, good morning.
Good morning, President Khan and our other commissioners. My name is Asa King. I'm the manager of our Office of Diversity, Equity, Inclusion, and Belonging. And I'm here today to request authorization to enter a contract agreement with Accenture LLP to provide racial equity training for our HSA executive leadership from the period of January 1st, 2022 to March 31st, 2022. The contract amount is not to exceed $129,000. You may remember that in December of 2020, I came before the commission and asked the commission to approve a resolution supporting racial equity. And also in that resolution, it included training on an annual basis regarding racial equity for the commission, in addition to our executive leadership. With this new contract with Accenture, we can fulfill that agreement and commitment that we have made as an agency to do ongoing training with our leadership around racial equity. Something that was mentioned earlier in our meeting about implicit bias training, that is definitely something that will be a component of this training to ensure that our leadership have the skill set, the tools, and the shared vision that we need to continue to move our racial equity work forward as an agency. And we definitely look forward to the opportunity for first our leaderships to get this training to really help shepherd the process with staff. And then we have further plans to work with our citywide Office of Racial Equity to provide racial equity training to our broader staff. But this is really our first step to first start with our leadership and continue to expand. So I thank you for your support in advance and welcome the opportunity to answer any questions that you may have.
Thank you. Are there any questions from members of the commission?
Yes.
I just have one question. James McCrae, good morning. Hello. Ms. King, I'm just wondering through the chair, Mr. Chair, if at the conclusion of the training in March, we might hear back how it went, what were the significant issues, just to get a feel for how this process is going, because it's fundamental to the work that we're doing internally and thus the work we do with the community. So I would just like, as a member of the board, after the March event is completed, we hear back how it went.
I agree. I think that will be very important.
Okay, so we're counting on you.
Well, I'd be more than happy to come back and give a report. And just also as a reminder, I do provide written updates about our status every month to you and the report that Trent gives to you all. So happy to come back.
But we like to see your face.
It's always been a good experience. And so
and a nice smile.
Thanks.
Okay.
Mr. President,
Yes,
the question, why is there no contingency?
I don't see it.
Hi,
Zero.
this is Elizabeth Leone. I'm the contract manager for this particular contract.
Yes,
We did not include a contingency. We are trying to keep it at a certain level in order to get it through the PSC, in order to get it through the Civil Service Commission. So we had a cap at 129,000.
Get it through the what?
We had a cap at 129,000.
So Elizabeth, that's an artifact of the bid process that you used, isn't it?
Yes, sorry, yes.
Yeah. So if we use an informal bid process, which we did in this case, we have an upper limit on the amount of money. And so we are going to bring this one in for $129,000 or less if there's any underbilling.
can we just ask for a motion to approve?
So move.
Second,
Second,
all in favor? Aye.
aye,
So moved. Thank you.
thank you.
Item G, requesting authorization to enter into a new contract agreement with Code 42 Software Incorporated for the provision of data risk and protection software for the period of October 1st, 2021 to September 30th, 2024, in the amount of $150,000 plus a 10% contingency for a total amount not to exceed $165,000. Alex Choquette? Calling on Alex.
It will help if I am muted. Good morning, President Khan, Commissioners, and Deputy Director Kaplan. My name is Alex Choquette, an Infrastructure Manager from IT, and I'm here to request authorization to enter into a new contract with Code 42 Software, Inc. for the period October 1st, 2021 through September 30th, 2024, in an amount of $150,000 plus a 10% contingency for a total amount not to exceed $165,000. The purpose of this contract is to provide data risk and protection software. HSA has used Code 42 software for data risk protection and response for 5 years. It was previously purchased through the Office of Contract Administration's Tech Marketplace. However, we are looking to migrate all of our data from being on-premise to in the cloud, which now means a business associate agreement is required and a software maintenance contract that will be directly between HSA and Code 42. HSA uses Code 42 services to provide automated backup and recovery of user data on workstation computers. The Code 42 system includes standard backup recovery in case of device failure, and additionally, it is used by HSA to ensure retention of data that may be subject to litigation hold. Code 42 service includes litigation hold functionality that prevents users or administrators from accidentally or routinely deleting data under hold, i.e. in the course of decommission accounts after separation from employment. I'm happy to answer any questions you may have. Thank you for your consideration.
James McCray, I'm just asking, does the coverage include every computer at every one of our sites?
No, the coverage is based on licensing, and we are primarily focusing those licenses on senior management that is subject to litigation hold.
Ah, okay, thank you. So move.
Can I ask for a motion to approve? And then
James McCray, so move.
Second.
all in favor?
Aye.
Aye.
So moved.
Thank you.
Thank you. Moving on to item 9, public comment. Is there any public comment? Seeing none, then our meeting is adjourned.
Good month, colleagues. Thank you very much. And thank you, HSA family.
Thank you, Dr. McCray. Thank you, Dan, Kaplan, and all
Thank you.
commissioners.
Thanks,
Thank you,
everybody.
everyone.
Thank you, Chair.